This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program. I'm Dave Wilson. Coming up this morning, we'll be discussing breast cancer screening to surgery. Got a couple of guests on the line this morning. Joining us is Mon Health surgeon, Mon Health Surgical Care, Dr. Kristen Statler, along with Mon Health Cancer Center oncologist. I'm just going to refer to him as Dr. Qazi. Good morning, guys.
Good morning.
Good morning.
Well, thanks for taking a few minutes with us today. We'll get into the subject at hand. Of course, October is Breast Cancer Awareness Month, but first, a little bit about you. We'll start with you, Dr. Statler. Just tell us, I know you've been on the program before, but give us a little background about how you ended up with Mon Health.
Sure. So I'm originally from Morgantown, West Virginia, out on the western end of the county. I graduated from Clay Battelle High School, and then I did all of my undergrad and medical school training at WVU. I then went down to the southern part of the state to Charleston to do my residency, and then when it came time to choose where to work, I wanted to come back home.
What drew you back home? Why not go somewhere else and work? Why come back home?
Well, I love home. I had a great childhood growing up here in Morgantown. I wanted to get back to my community and be close by to my parents to keep an eye on them because they can get in some trouble.
That's as good a reason as any, keep an eye on the folks. And Dr. Qazi, a little bit about you.
Sure. So I was born and raised in Charleston, West Virginia. After a brief stint out of state before college, I actually did, just like Dr. Statler, did all my training here at WVU. Been here in Morgantown for about 20-some years. And about 3 years ago, I came here to Mon. What drew me to Mon was, even when I was across the street, actually, had really great interactions with Mon physicians. I really found that, they really had this great relationship with their patients. Their patients raved about it, and the level of care they got was always outstanding. So, when I was looking, I wanted to do general hematology and oncology. Mon had a position for me, so that was, I was sold and been loving it ever since.
So before we get too far in, where do each of you actually practice? Where are your offices located here in town? Dr. Statler?
So my office is located in Building 1000, which is right at the bottom of the hill here below the hospital.
And Dr. Qazi?
So I'm a traveling man. So I do see most of my patients here at Mon Health Medical Center at the Zelda Weiss-Stein Cancer Center. But I have a one-day-a-week clinic over at Stonewall Jackson Memorial Hospital in Weston, West Virginia. And then we just started a presence in Preston County at Preston Memorial Hospital. So we're Kingwood once a month, and that is hopefully going to increase as we do offer more services down there to the folks in Preston County and nearby localities.
Now, I did mention, of course, we've been talking about breast cancer awareness. October is Breast Cancer Awareness Month. And last week talked to Dr. Saunders and Tricia Julian, and we really discussed treatment and recovery from breast cancer. So we'll start with Dr. Statler, and then Dr. Qazi, I want you to weigh in as well. But where do your roles fit into this whole process from start to beginning, or from beginning to end, I should say?
Well, a lot of times you meet me right at the very beginning, either after you've had an abnormal screening mammogram or, when I've ordered your mammogram and we come up with an abnormal result. So I start at the very beginning. I work my way through treatment with the patients, and then I stay with them through the recovery process. And usually after you've recovered from and been treated from breast cancer or a breast abnormality, you stay with me in my office, and I follow you yearly for all your screening mammograms going forward, too. So I'm there throughout the entire process.
And Dr. Qazi, where do you fit in?
So like Dr. Saunders, I'm a medical oncologist. I actually usually see people after the diagnosis has already been made of breast cancer. We're heavily involved in, multidisciplinary treatment that is with the input of the surgeons, the radiation oncologists, the pathologists, radiologists, in deciding, what the best treatment course is for each individual patient. So, what patients see me kind of after the diagnosis has already been made, and we help as a medical oncologist. We help them navigate, their, immediate treatment and their long-term follow-up and treatment.
From the discussions we've had previously, this isn't a case where, I'll use you as an example, Dr. Statler. You show up, you do the surgery, you check in the next day, and the patient never sees you again. Or Dr. Qazi, after the diagnosis is made, you show up, yep, that's the diagnosis, good luck with that. There's a team here that will follow the patient from beginning to end and continue, hopefully, after the cancer has been in remission as well. Is that fair to say?
Correct. I tell all my patients, whether they like it or not, they're stuck with me for life after we make the diagnosis. We make sure to follow them going forward for all their breast care needs.
Our guest this morning, Dr. Kristen Statler, Mon Health Surgical Care, and Dr. Qazi, Oncologist. I would try your first name, Dr. Qazi, but I know I would. I don't have Sarah here to help me out with those anymore, so I know I would butcher it.
Like Sean with an M at the end. That makes it sometimes easier. In school, that was always easier for people to say.
See, I see that now. All right, we'll continue our conversation. We'll get into breast cancer screening to surgery. We'll talk about it next. It's Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Dr. Statler, Dr. Qazi, our guest this morning, surgeon and oncologist, Mon Health Surgical Care, Mon Health Cancer Center, talking breast cancer screening to surgery this morning. So what are the different types of mammograms, and are there other screenings that can detect breast cancer?
Sure, I'll take that question here first. So usually the way that people feed into the screening process for breast cancer is usually with a regular bilateral screening mammograms ordered usually by the PCP, and that's just really a specialized type of X-ray that really is geared to really finding any abnormalities in the breast itself. That can be followed up and sometimes replaced with depending on the actual patient with a ultrasound, which can help define different areas that it might be abnormal on a mammogram. And sometimes we see that, in younger patients or with patients who have more dense breasts, sometimes we have to follow these up with an MRI, a breast MRI, to help better detect certain abnormalities that are found on a screening mammogram. And this is all, in addition to what we do recommend for all patients is to do self-breast exams on top of the clinical breast exams that are done by providers, the PCPs and the OB-GYNs, and a lot of the first contact for these patients. So we really do try to impress upon patients that, women really know their own body, and, they know the different, changes that they normally do go through when they're like in their menstrual cycle. They might have some spots that are what they know to be kind of normally occurring, and then if they do know that and they do keep up with those self-breast exams, that they do then tend to be able to find spots that are different or a little bit suspicious, and then that's where we can really use the expert imaging that we do have here to further investigate.
Yeah, and that's where I wanted to go next. So what are the next steps if a mammogram is concerning? Are there further tests to confirm, and what would those entail?
So like I said, usually after those screening mammogram does come up abnormal, usually we'll do what we call a 3D tomo mammogram, which is just a higher quality screen, and then again maybe followed up with a breast ultrasound as well, and then like I said, maybe even a breast MRI. Those all lead into just basically trying to figure out, from the image standpoint, exactly define what is the abnormality, and that helps us decide, what type of further tests, including a biopsy, to actually do.
Okay, when would a biopsy be ordered?
So a biopsy is often ordered when we think that there is a suspicious area that is suspicious enough to warrant additional tissue diagnosis. We determined that, and we talked to all of our patients about the BI-RADS score on imaging. So BI-RADS is a fancy way of standardizing all imaging, and we will tell patients it goes from 0 to 6. And if they get a 4 or greater, then they definitely need a biopsy because there's enough changes in the tissue on imaging that we're concerned. And there are different types of biopsies that we offer. So depending on how the imaging showed up with the abnormality or the way that it's best seen on imaging will determine our biopsy, which we do ultrasound-guided mammatome biopsies, and then there's surgical excisional biopsies to test the tissue itself to get a diagnosis.
We're talking to surgeon Dr. Kristen Statler, Mon Health Surgical Care, Dr. Qazi, oncologist, Mon Health Cancer Center, and we'll get into some of those surgical treatments when we return on the other side of this timeout. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Dr. Statler, Dr. Qazi, our guests this morning. And want to move on to surgeries and different types of surgical treatments that are available. And Dr. Statler, how do you determine what treatments are best for each patient?
So treatment is individualized to each patient and their wishes and their history. So anytime that you have a diagnosis of breast cancer, when you come into my office, we sit down and have a very long talk about all the different options that are available and what the benefits of each option are, what the risks are behind those options, and then going forward, what's best for you. So one woman may have the exact same type of breast cancer as another woman, but based on her history or her personal wishes may choose an entirely different treatment. It's very individualized. In general, we talk about lumpectomies and mastectomies, and then whether or not radiation or chemotherapy would play a role after surgery.
And Dr. Qazi, you're part of this conversation as well when it comes to surgical treatment and post-surgical treatment?
Well, so actually, there is several times when, we actually, in certain situations, in certain types of breast tumors, we actually can offer prior to surgery chemotherapy to help reduce the size of the actual cancer to actually make it easier to either do the actual surgery itself and maybe even allow a woman to have what we call breast conservation surgery. And also it gives us a little bit of a kind of insight into the actual cancer itself. So there's a subtype of breast cancer called HER2-positive breast cancer that, we see a lot now. It's actually probably rising in incidence. And in that, we know that if we give people chemotherapy before actual surgery, we can actually, many times reduce the cancer to nothing. Like there'll be what we call complete pathological response, and it really aids in the surgery, but it also gives us more information on what treatment really is appropriate for that person after the surgery itself, and that is leading to better outcomes in terms of overall survival and progression-free survival.
Dr. Statler, if a tumor and the proper treatment ends up being a mastectomy, is breast reconstruction available at Mon Health?
Absolutely. We have our own plastic surgeon, Dr. McClellan, that works very closely with all of our general surgeons for breast reconstruction. There are multiple different options when it comes to breast reconstruction. So what happens is if a patient requests or would benefit most from a mastectomy prior to surgery, we introduce them to the plastic surgeon, Dr. McClellan, and we start talking about the types of reconstruction that are available and really kind of how we proceed forward with that surgery, because that's kind of a week to months recovery time for that surgery. So we want to prepare every woman for the process going forward.
How does family history factor into all this, from the screening process to choosing the proper treatment?
So it does impact, especially, in this day and age when we know what, family history entails in terms of its impact in the actual molecular biology of the breast cancer. So, we know that about 5 to 10% of all breast cancers have a hereditary component to it. And knowing those things going into the diagnosis helps in figuring out exactly what are the associated treatments that are better suited for that patient, and also then that kind of preventative down the line. Now, luckily we have a genetic counselor here, Jessica Four, who's specialized in actually helping us order the right testing to find out if there's a genetic component to these cancers. And then, it informs us, and we still have to have that discussion with the patient, herself, to actually decide what will be the best, course of treatment. But it does definitely inform what we do from surgery to chemotherapy to, post-surgical surveillance and treatment.
One of the takeaways, and this is each and every week when we talk about, it doesn't matter what we're talking about, the major takeaway I always come away with is each individual's treatment is personalized. It's not a one-size-fits-all. You don't go, okay, this checks this box, we'll go with this. You're going to sit down with each patient, and each treatment is going to be individualized from start to finish.
100% correct. I think from both the surgical standpoint and from the oncology standpoint, precision, they call it precision oncology or precision cancer care, is basically the new buzzword, and that's how every cancer is treated here at Mount General Hospital.
And, and Dr. Qazi, going back, 15, 20, 25 years ago, that precision wasn't as available. You had to kind of bombard the body. Now, and I don't have a full understanding, but from what I understand, you can be a lot more precise, target the cells you really want to target, can't you?
Yeah, actually, that's I joke with a lot of my colleagues and even my patients. I say, I'm a chemo doctor that would like to not give chemotherapy anymore. General, chemotherapy, you can think of it as just basically a poison that affects whatever the cells are growing the fastest. And, we're really trying to move away from that in all avenues of cancer. And breast cancer is probably one of the best examples of that with our HER2 positive breast cancer. We, back in the 80s and, 90s, they found this HER2 target and actually started treating it with the first drug, which was Herceptin. And, that has really revolutionized the treatment of this very aggressive cancer. That used to be one that, really led to a lot of mortality very early on. And now, we're seeing, people live 5, 6+ years, even with metastatic, cancer. It's amazing. And like I said, so I will love the day when I don't have to give any more chemotherapy to anyone.
Got about a minute left. Where can patients get their annual mammograms through Mon Health?
So we have several locations. We have mammograms offered in Morgantown, Fairmont, Grafton, Weston, and Kingwood. You can schedule your mammogram by just going to monhealth.com/mammogram, or you can call your primary care physician or one of our offices to get scheduled.
And how can people reach out to you? Will they be referred to see you guys, or can they make appointments? How does that work?
Oftentimes they're referred to see us after they've had an abnormal mammogram, but they can schedule things or call us if they need to see one of us, and they can reach us at monhealth.com/mammogram or monhealth.com/cancer.
And, of course, always more information about Mon Health in general over at the Facebook page. Dr. Qazi, Dr. Statler, thanks for taking a few minutes with us this morning, and keep your folks out of trouble, Dr. Statler.
Thank you.
All right, guys. Appreciate it very much. Of course, this will be posted up over at Mon Health's website if you would like to go back and get more information from the show.